Today, we're diving deep into a huge public health issue, diabetic kidney disease. It's a silent crisis affecting millions. But what if a potential ally in this fight has been with us for, well, millions of years, hidden in the leaves of a tree that's older than the dinosaurs? Let's get into it. Let's start with a number that's, well, it's pretty staggering, 50%. For about half of all people with diabetes who end up with kidney trouble, their condition is going to progress all the way to total kidney failure. Just think about that. It's basically a coin toss for a diagnosis that changes your entire life. And then there's the money, $25,000. Now that's not a one-time cost. That's the estimated price tag per patient every single year just to manage the severe form of this disease. And that doesn't even count treatments for all the related problems, like heart issues. It's an absolutely crushing burden.
But honestly, beyond the statistics and the dollar signs, the real cost is time. 16. That's the average number of years of life that are just lost. So this isn't just about managing a disease, it's about losing years of your life.
Okay, so with those numbers setting the stage, let's zoom out a bit. Because when you look at the big picture, you realize we're not just talking about individual tragedies. We are staring down a full-blown global kidney crisis. So what exactly is diabetic kidney disease, or DKD? Simply put, it's the #1 reason people's kidneys fail worldwide. Think of it like this. Having constantly high blood sugar is like flooding your body with a corrosive substance. It creates this constant, low-grade fire of inflammation and oxidative stress. You can almost picture it as a kind of cellular rust. And this rust just relentlessly attacks the tiny, delicate filters in your kidneys until they just can't do their job anymore. And here's the scary part. The damage doesn't stop at the kidneys. It spirals outward. You end up with a cascade of other massive problems. You're looking at needing dialysis or a transplant. Your risk of dying from any cause literally triples. And your chances of having a heart attack or a stroke, they go way, way up. That's the key here. The fire starts in the kidneys, but it can end up burning down the whole house.
So you're probably thinking, okay, this is really bad. What are we doing to fight it? We've got to have some weapons, right? Well, we do. But this is where the story gets really complicated, because there's this massive gap between the treatments we have and the solutions we so desperately need.
And this really shows the contrast. On the left, you've got our modern medical arsenal. We're talking lifestyle changes, powerful drugs to manage blood pressure in the kidneys, even brand new stuff that helps flush sugar out of your system. And look, they definitely help. But, and this is a big but, look at the right column. That's the unsolved problem. Even with all these tools, there's always this residual risk left over. The disease keeps marching on, and for too many people, the prognosis is still pretty grim. And this quote from a 2021 study just hits the nail on the head. Even when we do everything right, when patients get the best care available, the danger is still there. It's like we're missing a critical piece of the puzzle. And that is exactly why scientists are searching so urgently for something new, something that can work alongside our current treatments.
So, if our most advanced, cutting-edge medicines can't solve this on their own, where else can we possibly look? Well, the search is leading scientists from the lab bench all the way back into the deep past to an ally that's been on this planet for an almost unimaginable amount of time.
I want you to meet Ginkgo biloba. And calling it an old tree is a serious understatement. This thing is a literal living fossil. It was around during the age of dinosaurs. We're talking 345 million years. It survived ice ages, it survived cataclysms, and for centuries, especially in its native China, its leaves have been a cornerstone of traditional medicine. And today, of course, you can find it everywhere.
Now, when scientists talk about ginkgo, they're not just grinding up some leaves. They're talking about a very specific, standardized extract. Think of it as a concentrated, high-potency formula. And it's not just one magic ingredient doing all the work. It's a complex cocktail of natural compounds, mostly these flavonoid glycosides and terpene lactones. It's like a whole symphony of molecules working together.
And that natural symphony, it has some well-known effects. We know it fights that cellular rust, that oxidative stress. We know it's a powerful anti-inflammatory. It helps with blood fats. It can even help with clotting. But hang on a second. Remember what causes all that damage in the kidneys? That constant fire of inflammation and oxidative stress? The very things that ginkgo seems to be so good at fighting. Is it possible we've stumbled upon a perfect natural fit?
And this is the moment. This is where our two stories, the modern crisis and the ancient remedy, finally collide. And it sets up the one central scientific question that researchers are scrambling to answer right now.
So, could it be? Could the power of this ancient leaf really be the missing piece we need? I mean, on paper, the theory makes perfect sense. But what happens when you move from theory to reality? What does the actual clinical evidence say?
And this slide, right here, is the heart of the whole debate. On one side, you have this incredible potential. Ginkgo's known abilities seem tailor-made to fight this disease. But on the other side, well, the results from studies in actual people have been all over the map. Inconsistent, sometimes even contradictory. So the promise is huge, but the hard proof that doctors need, it just hasn't been convincing enough. And that's exactly why we're talking about this today. To cut through all that noise and confusion, researchers have launched a new, super rigorous, systematic review. They're gathering up all the existing evidence, sorting the good studies from the bad, and hoping to finally give us a clear, reliable answer on whether Ginkgo is really a safe and effective tool for patients with DKD. So we're left with this one final question. The human need is desperate. The science is incredibly promising. And the history is undeniable. Will this ancient leaf, a survivor from a world we can barely imagine, become a key part of our future medicine? That is the billion-dollar question that science is racing to answer right now.